by saying you are the future, or at the very least, a fundamental part of a healthier tomorrow. As a former teacher, I have a passion for lifelong education. So I want to congratulate CATSINaM on the work you do to encourage and support the lifelong professional development of nurses and midwives. Nursing and midwifery professions are highly regarded, and rightly so. You work at the heart of health and can carefully and constantly drive change for the better. You support expecting parents, deliver our children, and are committed to caring right through our senior years. I'd like to outline my Indigenous health priorities, the key areas where I'm asking for your help now and as we work together to further develop programs in the future. These include renal health, hearing, eyesight, maternal and child health, men's health, and avoidable hospital admissions. We know that social and cultural determinants contribute to more than 1/3 of the average health gap between Indigenous and non-Indigenous people. This figure rises to over half the gap when we add in other risk factors like alcohol and substance abuse, poor diet and smoking. Whether we are focusing on traditional clinical services or holistic cultural approaches, there is no doubt the more Aboriginal and Torres Strait Islander people and health professionals like you will make a difference. We have working in the field, the better it is for our communities. Communication and partnerships with communities are crucial to closing the gap in Indigenous health outcomes. Over half the staff at one remote corporation I visited recently were Indigenous, and it came as no surprise that the group continues to chalk up some outstanding successes. At the same time, the passion, dedication, and achievements of non-Indigenous nurses, midwives, and health professionals cannot be understated. So many of you have chosen to dedicate your careers to roles that directly address the health inequalities of our people. It takes a genuine partnership between all of us working side by side to close the gap. Modern nursing and midwifery is often fast-paced with regular advances in medical research, diagnosis and treatment. What you do so well is localising these best practice clinical services to change lives for the better. We must continue as a priority to build a strong and supported health workforce with the skills and understanding to provide culturally safe and responsive care. We need to make sure more people study nursing and midwifery and see these professions as rewarding and worthwhile long-term careers. Through CATSINaM's leadership, nurses and midwives have access to mentors, leadership programs, and networking opportunities. I know that many people at this conference are helping to expand the cultural competency of health professionals. We all have the right to kind and culturally comfortable care of the highest clinical standard, no matter where we live or who provides our health services. The Turnbull government is committed to doing things with Indigenous people, not to them, by walking and working together. Coupled with your compassion and commitment to professional development at this conference, I know we will grow healthier and stronger communities and help our people claim the future they deserve. I want to thank you for your contribution, your commitment, but your ongoing support of each other in helping me and the Turnbull government to close the gap in the health of our people. You play a key and vital role, and it is important that we continue to meet, talk together, work together, and strive together to make that difference. Enjoy your time together.